So this afternoon, Fiona's invited me to give you a workshop so that you can begin to personalize this and start working out for yourself where you are in your mind, in your body, in your spirits, and your environment. And I'm going to start by putting this in context. So roughly speaking, over the next couple of hours, I'll give you an introduction, 25, 30 minutes or so, and then we'll go into a workshop called The Picture of Health. I found the Bristol Cancer Help Centre in 1985 as a young doctor, absolutely full of desire to work in a holistic model. What brought me in was that my best friend at the time had an irritable bowel, and I noticed the way that her health fluctuated with her state of mind. So when she got anxious and upset and nervous, her bowel was absolutely dreadful. When she was in love and excited and happy, everything settled down and she had no problem. And that got me thinking what on earth was going on in terms of this relationship between her mind and her body. I would say first and foremost, I'm a mind, body, spirit doctor. I'm not so much a metabolic or a functional medicine doctor. And this tool that I created called The Picture of Health came out of our model at Bristol. So I had the privilege for those 15 years of being part of a team where we had a holistic doctor, nurse, transpersonal counsellor, spiritual healer, nutritional therapist, music, art, body work, energy work. And we used to meet as a team every breakfast, lunch, supper time to actually see what we were picking up about all of the different aspects of what was going on for somebody. So we ended up with a really good map of what was going on for our clients. But the client themselves didn't have that map. So I thought, and many people said to me, where are the goalposts and how will I know when I've reached them in terms of this holistic model? I've seen this therapy and that therapist and that therapist. How will I know when really I am whole and when I'm on the right page? So I'm going to lead into that, but first I'm going to put this in context of showing you a little bit of why I at the point of the millennium in 2000, really somewhat crossed the tracks and decided to dedicate the rest of my life to what I now call health creation. Because when people came, like you, to the Cancer Help Centre, when they'd been there for a week and really got to look at what it is about their life that they absolutely loved, they went away on a Friday afternoon saying, why did it have to take illness to bring me to this realization, to start living my life for me, you know, to reincarnate in this lifetime as myself? And so I just thought, well, why don't we bring this all back up the river and see if we can bring this into prevention and into helping everybody to live at peak potential in the kind of happiness and wholeness that many of you now enjoy today. It's gradually taking hold, and I'm very proud to tell you that we're now into 21 Bristol schools. We're working with the executive group at Bristol University. We've worked with people in HSBC Bank. And bit by bit by bit, I could tell you more, but we're gradually moving into this. As of last week, we're just writing an agreement to take health creation into America, where because of the collapse really of healthcare systems under the economic burden of lifestyle illness, people are finally waking up to the fact that we have to make health, not illness, the norm. Would we not all agree? Yeah? So I'd just like to see how many of you here have come because you've been ill yourself. Lots and lots, about half. And how many of you are here because you're a healthcare professional? Half and half. So some of you, a bit of both. How many of you are here because you've come to find out for other people? Yeah, lovely mixture. Okay, well, I hope there will be something for all of you. So let's just look at the picture. Just like to give you a snapshot of the current state of health in our country and where the money's being focused and what I see the role of health creation as being. In this system of ours, we are spending at the moment 110 billion, roughly quarter of our entire tax revenue on health. But is it health? Absolutely not. Guess what? 107.5 billion of that is in medical care, and less than 2%, 1.9% in public health, 0.8% on research and development. So how crazy is that? And it's the same if you look at the statistics with Cancer Research UK, something like 45% is being spent on the research of cancer, 45% on the research of treatments, and a tiny, tiny, tiny bit on prevention. So this is what has to change, because this is a completely preventable disease in the long term. Even by CR UK standards, they're talking about roughly 81.5% of cancer being lifestyle related, to do with smoking and eating and lack of exercise. We would add to that stress, malaise, and people becoming dispirited. You know, what we were doing at the Cancer Help Centre was reawakening people's spirit, getting people back in touch with what completely fired them up, what uniquely turned them on. Because the minute people were re-engaged with their life, full tilt boogie, something amazing happened to the body. And I've come to view this a bit like plants and photosynthesis. You know, when the sun comes out, plants start to metabolize, and the light actually excites those cells so that they make oxygen and they make carbohydrate and all the other gorgeous things that the plants make. Well, it's the same for us. When we are filled with love light, the light of our soul, the light of our passion, the light of our love, our cells work better. So that's why I focus on the state of the spirit and the mind. Of course, I'm all for good food and good nutrition and good supplementation. But primarily, I'm about helping people to come alive and come home to themselves. So this is the really depressing slide that I'm going to whiz over very, very fast, but we all know that now 1 in 3 of us, going up towards 1 in 2, is expected to get cancer in a lifetime. Completely unacceptable. 1 in 2 arterial heart disease, 1 in 3 alcohol or drug dependent, 1 in 4 clinically depressed in a lifetime, 1 in 3 adults living alone prone to isolation. Need I go on? You know, this is now the so-called norm in our society. Well, that's not all right with me. So if we just take a brief look, cancer, supposedly 81.5% related to our lifestyles and our environment. Heart disease, they say 75. Diabetes type 2, 100%. Obesity, perhaps 95%. And all of these things are completely flooding medicine. And we are on a path that is just as critical as the global warming path in terms of collapse of the system. I mean, right now, today, if any of us suddenly got chest pain, we could ring and we could reasonably expect an ambulance to be here in 10 or 15 minutes. You look 10 years down the line, at the point where we have aging population and almost everybody with heart problems and so forth, and that's just not going to be the case. And we have to actually shift our state. You know, the whole of holistic medicine is about state shift. It's about leaping up into a different octave of your being, and we can all do that. So this is about the return to balance for every single one of us, and it's about every one of us working out which is our way home to ourselves, which is what is the lifestyle in which our heart sings, and in which we feel that we are actually living out our birthright, not in a bored, depressed, you know, upset state, carrying burdens of stress and illness that turn into physical pathology. You know, we're born onto this planet for the love of life. So I want to tell you how possible healing actually is. This beautiful woman, Gillian Gill, came to see me around 2000 with stage 4 ovarian cancer that was affecting her liver. Her tummy was looked about 8 months pregnant. And Gilly told me on the very first meeting, I'm not actually up for any kind of conventional medicine. Now, that's unusual. I don't get many people who say that. But Gilly basically said, I would personally rather die than have medicine. So I thought, right, that's clear. I can work with that. She had nursed her sister through severe cancer, and her sister had eventually died, and she had just hated seeing her going through all the medical approach. So Gilly opted to work with, I would say, primarily self-healing. Jilly did an awful lot of inner work with visualization, tuning in, spiritual healing. But she worked with her she worked with everything, you know, everything that you've heard about, energy medicines and herbs. And she took the Indian herb Karktol that I learnt about in 2000. And it took 2 years for Jilly's liver to clear. So we knew we were on the right track because after 2 years she had a completely normal liver. And then after 4.5 years, what had been a mass in her pelvis turned into a cyst. And just last year, after 10 years, her CA125 level was completely normal again. And just look at her. I mean, she just radiates, doesn't she? So this brilliant lady and others in my acquaint have shown me without any shadow of doubt that cancer is a two-way process and that we can heal. We can heal our body. And if we actually commit ourselves to that path back into the heart of our lives, that we can heal. So the great joy of having been doing this for 28 years is that when we started, it was all primarily to do with the creative intelligence of the brilliant Penny Bron, who, when she was diagnosed at 39, back in the 70s, said she'd trained as an acupuncturist, and Penny said, well, there has to be some way of getting myself into the winning statistics. At that time, it was a sort of 55-year survival rate with breast cancer. And Penny said, well, what's the difference between those people and those people? And she went around the world to the Gerson Centre to see Joseph Issel. She went to monasteries and acupuncturists and Isabella Maxwell Cade for mind-body therapies. And she resorbed her primary tumour and realised she was on the right track. But at the time, people absolutely slammed her. You know, the medics said it was irresponsible, dangerous, false hope, you name it. But bit by bit, evidence, scientific evidence has come in for every single level of the holistic approach. Stephen Greer back in the 80s talked about the survival benefit of positive fighting spirit and of coming out of depression. Well, every depression study ever since has shown that if we're depressed, we're more likely to get ill and to stay ill. If we can lift depression, we do better. Emotional support showed that people receiving support, Spiegel and Forsey, that again, doubling of survival. Then came the evidence for acupuncture, the neuropeptide links in the brains, that all came through. Then we got psychoneuroimmunology and Candice Pert and others. If you haven't read The Molecules of Emotion, seminal book showing about how every single moment we are shedding trillions of molecules of emotions, but not just from the brain to the tissues, also from our tissues to our brains. That we can, in seconds, change our physiology, change the whole state by adopting positive emotions. So when we work with visualization and so forth, this is profoundly affecting our cell chemistry. We then had massive studies, the China study, the San Diego study back in 2007, showing that people, this was women with breast cancer who adopted both exercise and healthy eating, doubled their survival 9 years down the line against women who didn't. Fantastic evidence. This was a breakthrough because people had always said, well, we have a feeling diet is involved in getting cancer, but we definitely don't think it's got anything to do with getting better once you've got it. But this showed that actually changing the way you eat can make a radical difference as long as you also exercise. So it was exercise and nutrition together that made the difference. Environmental and functional medicine, you know, huge steps forward in terms of understanding how toxins are interfering with our body's ability to cleanse and our immune system to stay healthy. The role of exercise. Leslie Walker, professor at Hull, showed us categorically that relaxation, hypnosis, people visualizing their chemotherapy, curing them, again, made a radical survival difference. So these ladies only got half an hour of hypnosis and relaxation 6 times around the time of their chemo, and double as many were alive about 10 years after the chemo who got that intervention. Spiritual healing, If you haven't read the books of Larry Dossey and Dan Benor, these guys have collected together all of the studies showing that when we are prayed for, when people are sending us healing, makes a massive difference. So definitely, Larry Dossey said it is now unethical for him not to pray for his clients because the evidence is so strong. And then my big hero, Dr. Dean Ornish, who's a cardiologist, in fact. But Dean was the first person who showed that with lifestyle programs, you can reverse coronary artery stenosis. And now he's proved that people on his lifestyle programs are costing their insurers £30,000 a year less in the first year post-diagnosis. And so he's had a breakthrough because American insurance companies are now funding people to do these lifestyle programs. And they're simple programs. It's not complicated. You know, this is actually low-fat, healthy diet, exercising 45 minutes a day, yogic relaxation, and talking to each other, communication, connecting, love and intimacy. He actually uses the words love and intimacy. And interestingly, when he got his first findings, it was shown that people, after the first year where they started to get these changes, people thought, oh, well, it's obviously the food and the exercise. And the group split itself. And what started to happen was the people just doing the food and the exercise, their coronary arteries started to clog up again. Not as fast as people doing nothing, but it was the combination with the emotional support and the relaxation and the meditation. And finally, we come to the thrilling new frontier of epigenetics, whereby we're seeing that actually how we think, how we behave, what we eat is actually going right into the how our genes are expressing themselves. And what we get is a movable feast. So we are not any longer thinking of ourselves with one set of genes for life that we're born with and that's it, done deal. We're actually seeing our genes as a movable feast. And depending on how calm we are, how bright we are, how happy, how illuminated we are, our genes are turning on and off. So here is the beautiful Dean Ornish, who is himself a yogi, who's committed to this dual path of medicine and yoga. And this is the San Diego study. I'm sure people have said already this morning that with our food, it's a combination of us being overfed, undernourished, and toxic. This was another study, a mile-a-day study, showing that most type 2 diabetics, just walking 1 mile a day could come off their diabetic medication. So if they just walked enough to digest away, to metabolize away the sugar that was in their blood, they didn't need to be on the diabetic medication. Now, if that was a drug, everybody would be on it. You know, it's we need to get this information into society. So Dean has gone on and looked at this with prostate cancer, and his study is the Geminal study. And what he showed was that after only 12 weeks on a lifestyle program, that some 48 genes upregulated and some 453 genes downregulated in terms of the expression. And this is vital because these are the oncogenes that actually control cell replication and growth and so forth. So this is a bit hard to read, but I think you'll just accept the fact that over time it's become more green. So this is as the spectroscopy is changing over these 12 weeks. And lots of interest is now being focused on this because it puts the power back in our hands, doesn't it? It means we're not stuck with a condition. It's a very, very movable feast. This is a bit of evidence from Japan. I've been involved with a healing group in Japan who practice something called Jo-Rei. So the Rei is the same Rei as in Reiki, but it's the divine light of purification as opposed to universal light. And in the Jo-Rei membership, the elderly, they measured the difference between ill health, very low in the Jo-Rei members, who basically practice this lovely healing methodology in their families every day. They give and receive healing to each other in the family. And very low use of medicine by the Joe Ray, 66% not using medicine as against 22 in the society, lower stress and so forth. But the bottom line is they were costing their medical insurers 50,000 yen as opposed to 90,000 yen in the general population by observing healthy diet, daily spiritual practice and community. They actually connect with each other, they meet, they volunteer, they practice gratitude. So profoundly loving group of people showing, that could halve the healthcare expenditure almost. Amazing. So what we're talking about in health creation and what all of you are engaged in is a shift from focusing on illness or even focusing on medical screening down to focusing on identifying what I call health-defining behavior. So there are ways that we be, there are ways we think, there are ways we act, there are ways we eat, there are ways we work, which are going to predict that in 5, 10, 15, 20 years' time we will either be obese or have heart attacks or have cancer. And if we can, through, this is what we do in health creation, is we try and work out how am I being now, which is going to actually cause these kinds of problems later on. So what we're trying to do is to change our focus in society from passive disease management to proactive health creation and create a value, a perceived value for actually getting ourselves into health. Now, this is the tool that we're going to be working on with each other. It's called the Picture of Health. And you know I said that in Bristol Cancer Help Centre we had a team that was really looking at people in 360 degrees. Well, the 4 quadrants of this circle are the body, the mind, the spirit, and the environment. And every dot represents one question which has seemed to me to be an important question. So when we as therapists and doctors and counsellors and nutritionists are actually working with people, these are the things we're thinking about in our mind to work out where somebody is in relationship to themselves. So what you're invited to do, there are 12 of these principles. So in the body, we're looking at how are you eating, exercising and taking care of your physical needs and your toxicity. In your mind, how stressed are you? How are your relationships and your emotions? We know that actually love and intimacy and support makes us much, much stronger and more resilient. On the other hand, we know if we're carrying toxic, heavy emotion, that's weighing down all of our survival mechanisms and our immune system. Okay? So we're looking at how much toxic emotion are we carrying. Over here in spirit, we're looking at this all-important fulfillment and how fired up am I. We're looking at vitality or energy level. And then we're looking at spirituality and am I sourced? Where do I go to resource myself, to get myself actually full of energy, full of light, full of love? Lots of us forget about our soul food. We may know what it is that actually illuminates us and really makes us shine, but do we take the time to actually put ourselves into our sacred places, to visit those special people, to do the things that we love doing? Does anybody recognize that at all? Yeah? Absolutely. I mean, we know what makes our hearts sing, and that's about giving it priority. In the environments, the questions are about what's the impact of your personal space? You know, are you living and working somewhere that makes you feel great, or are you living, working somewhere that makes you feel terrible? What about your relationship with your community? Are you plugged in, feeling connected, feeling like you belong, feeling like somebody would care if you actually fell over or disappeared, or are you feeling alienated and lost and lonely? Now, when you get to the questions in this one, I think I made a bit of a mistake. They sound a bit much like, too much like, are you a good neighbour? Are you a good citizen? If you can do those questions thinking about, am I, think about it in relation to all your networks, your social networks and your work networks and your any clubs or classes and things you're joined to. And finally, our connection to nature. So how much has that got to do with health? Well, ultimately everything. Our relationship to Mother Earth and to the plants and the animals and the trees is primary to how we are. And if we disconnect from nature, we suffer. We suffer in our soul, and we suffer in other far more basic ways. The plants produce oxygen, they produce energy. And many of us find that we feel the most healed when we are deep in nature. How many people feel? Yeah, okay. Pretty primary relationship. I had a lovely patient once called Linda who survived for 9 years with secondary lung cancer, secondary breast cancer in her lungs. And Linda, anytime her energy dipped at all, she just made straight for the forest. And she would lie on the floor, she would hold the trees, she would ask nature for energy. And she developed a strong primary relationship with raw Davic energy. And she, when she felt particularly low, you know, if it was very windy, she would just go and lean on the wind and actually absorb energy from the wind. You know, so nature is there for our nurture, and there's so much love within nature for us. So, the 12 principles you will be working through are written down on the worksheets that we're going to work through. Just want to say how it actually all fits together. When I came out of Bristol, Bristol itself was life-threatened. You will remember when Bristol got attacked by the skeptics, and there was a terrible research study, and it looked like Bristol was going to close. Well, I thought it was very important to put it all into a virtual package, so I created this thing called the Cancer Lifeline Kit. Because of 10,000, the other reason was of 10,000 calls we used to get at Bristol every year, only 600 people came. So that, to my mind, meant there were another 9,400 people out there who couldn't come because of illness or geography, or they didn't want to come to a group setting. So I created a kit and also a mentor service. And we've got some of our mentors here today. We've got Moretta, who's a health creation mentor, and Annie Berry sitting next to her. And so this model means that people can have their own guide, their own mentor, their own coach, sitting in their home, sitting in their hospital bed, sitting in a hospice, on holiday, on the end of a phone or by Skype, that you can actually be coached actually into your wellness and your happiness. And the aims of this program are to bring us into our happiest, most fulfilled and healthiest life, to help us reach our potential, to help us become authentic and true to ourselves, and to live out our higher purpose. So in the holistic model, I think you will know that the state of mind and emotions and body and spirit are now seen as being absolutely inextricably linked, and that we need to be nourished at every one of these levels to thrive and to be fully well. So we're going to be looking at ourselves from every single one of these levels. And what we do in health creation is we find out what aspects of our behavior or lifestyle are choking us. What are the things that are squishing the life out of us? And a bit like if you buy a house with a big garden that's become very overrun, you might first of all pull out the brambles and the nettles and the things that are choking the other plants. And then you might actually see what's growing in your garden. Where's the life coming through? And then in the third year, you might think, well, actually, that little tree might do better on the south wall. You don't go in with a plough and dig up the whole garden the first day you get there, do you? So this is what the holistic approach is about working with yourself or your therapist or your mentor to actually discover where the healthy life, what's right about you. You know, what is your essence? What are the things that really turn you on? So these principles for body, we've already mentioned. My colleague Jane Sen works with me, and many of you may know Jane. She was the head chef at the Bristol Cancer Help Centre for 12 years. And I've put in your packs information. Janie and I are taking a group to the south of France at the end of this month, on April the 28th, for a week till the 5th, to actually, in the sun, learn healthy cooking, do yoga, relax. So it's very short notice, but we do have a few places left if anybody'd like to come with us. On the exercise, we're not just talking about aerobic exercise, we're talking about yoga, qigong, tai chi, things that move our energy. I have a lady who's been working with me who had 5 bony secondaries in her lungs, and she went on a raw diet and started doing qigong with a guy called Neil Archer in London, and all 5 secondary tumours have gone from her lungs. This is the power of energy work. In our mind, you know here that the keys are to get rid of the stress, not only external stresses, but self-stressing tendencies. So half the questions you'll find are to do with how much stress you put on yourself. Perfectionism, workaholism, approval seeking. You know, those things that we do to kind of really wind ourselves up. And relationships, how able are we to receive love and attention and touch and compliments? The English disease, the British disease is, you know, to push everything away. No, don't say nice things about me. And I would say the primary unifying characteristic of almost everybody I work with is that they are too nice. You know, they're people who look after everybody else and put themselves at the bottom of the list of people that they care for. So actually being able to receive is primary. And being able to express our emotions. It goes along with being too nice. We don't get angry, we don't shout, we don't stand up, we're not difficult. And I'm sure you've heard that difficult patients do better. Did you know that? It's actually been proven statistically that people who fight their corner do better. Well, guess why? They've got a fighting immune system. If they're people who fight, they've got a feisty little immune system. If they're people that just go, oh no, you go first, you know, they've got an immune system that says, oh no, it doesn't matter about me, you go first. Okay, so get feisty and get clear about what you want and what you need. Okay, stress, we know that a little bit of stress helps us, it raises our game, it challenges us. But if stress goes on and becomes chronic, our immune system crashes, our cholesterol rises, our calcium is lost from the bones. So we have to get ourselves out of fear, out of startle, out of anxiety. And all of this, of course, is profoundly, as we've seen, affecting our tissue function. This was PNI in motion, Stephen Greer, proving that people with fighting spirit did so very, very much better with the same illness as people who collapsed and became helpless and hopeless. But you can learn how not to be helpless and hopeless. You can learn how to take your power. You can change the way you cope. Okay, so, you know, even if you feel you are that way, you can change. Lots of obviously good things, counseling, EFT, the journey, myriad ways, artistic, creative therapies, all the beautiful self-help techniques, meditation, relaxation, breath. Working with our spirits, I've stressed how important this is, but I just want to, jumping free is how I see it, you know, freeing ourselves up. You know, like Gulliver in Lilliput, where all those little ties, those threads were tying him down on the beach? Yeah, do you remember? Great big giant, Gulliver, but all those little threads. Have you ever felt like that? Like Gulliver on the beach, just strapped down? Well, let's get the scissors out, guys, and cut those threads and get you free. And I think when I first came into all of this, I thought, how can there be something like 250 complementary therapies? There has to be a core concept in all of this. And I realized that they all had a concept for energy, vitality, joie de vivre, you know, in homeopathy, vital force, shiatsu, the ki, acupuncture, the chi, yoga, it's prana. So the ancients recognized our energy state. They read the energy state. They could read through the pulse, through the hara, through the looking at the aura, what the state of a person's energy and vitality is. So this is key. But what I worked out was that actually, you know, we've all got a spectrum of where our energy is, and most of us in the Western world are only jogging around at about 50% because of what? Boredom, food, sedentary lifestyle, unhappiness, brokenheartedness, etc. You then get a blow that brings you down below this critical notional 30% level, and what starts to happen when your energy goes down? Your state of mind changes, doesn't it? You get demotivated, you lose your self-esteem, you lose your confidence, you feel frightened, you can't sleep. So you are tired, but you can't sleep. You get anxious. You know, these are functions of the energy level dropping. So how easy is it to self-help when you're in that state? Hopeless. Not at all. So you get some bright spark like me saying, all you need to do is change your diet and exercise. And I'll say, I can't. I can't even get the CD in the CD player. I am so low. Okay? So when your energy is down here, you have to receive energy. But how can you receive energy if you're a person that pushes it away all the time? So many people who have these illnesses are fountains. They're giving out, giving out. How easy is it to get close to a fountain? You can't. So the fountain has to become a pool. And you have to change your polarity so that you can receive. Does anybody relate to this at all? Yeah? Any fountains in the room? Yep. So we have to learn how to receive. And that's to do with the fact that we may have been wounded, we may not believe we deserve love, we may not believe we deserve touch or healing, but actually you do. Every single one of us, it's a birthright to receive this love and healing connection. So step number 1 is permission to receive, and actually to make an in-channel to receive. And then once you get over that 30% line, guess what half of my clients do? Oh, I'm back now. I can go and run a support group. I can go and actually, pay back all those people that have helped me. And the energy goes down again and people are back below that critical line. So step number 2 is, once we're back above the line, is putting ourselves at the top of the list of people that we care for. Okay, now for many of you that might initially feel selfish or self-centered, but it's self-focused. Okay, it's not pejorative. Instead of being other-focused, you are being self-focused. And at the point when you get up here to the 70% line, then you've got energy to spare, and then you are giving out from a full place, not from the empty place. Okay? So when we give from this empty place down here, quite often that gives us a good feeling. But actually, for all of you who are carers, the key is to get ourselves up here so that we're actually, people are walking in the room and feeling better because our energy is so strong. Okay? That's important. So down at this level, what we do to get our energy up is we have healing, we have supports, we have touch, we have energy therapies, acupuncture, shiatsu, things which will raise our energy. Then we can start self-help practices. And then when we get up here, we can start to teach and lead and help others. And the point is here that when we get above this 70% energy level, life starts coming towards us. Have you had that feeling, when you're so on song that suddenly, you think of somebody, they phone. It really feels like synchronicities, meaningful coincidences. You start, you visualize something, it happens. Yeah? Because what happens is, as our energy rises, our consciousness rises. And as our consciousness rises, we start remembering things. We start remembering our spiritual nature. We even often start remembering that perhaps dying isn't the end. Perhaps we start becoming connected to our essential spiritual nature. So actually raising our chi and getting our energy really, really, really high through whatever means is the key to regaining our equanimity, because that's where we become really still and really clear. So, spiritual healing I am a massive fan of, because that's been the cornerstone of the work at the Cancer Help Centre. That's the thing that's actually lifted most people to the point of becoming able to self-help. I'm patron of the Healing Trust, and I'm a teacher of Jo-Rei healing, the Japanese healing, where you can do it yourself at home. Anybody wants to find out about Jo-Rei, ask me. So in our environment, I think it's terribly clear living and working in harmonious, beautiful environments, again, lifts us. Belonging to, serving our communities, raises our energy, and being in conscious connection to nature. So any way that you can engage with nature. So the mentors, I've said, are there on the end of the phone or in person to provide the energy, the motivation, the love, the guidance, the support to keep people going. And we work with lack of judgment, pacing, finding the key, gently working through resistance. How many of us have actually said, I know I want to make a change, whatever it might be, losing weight, giving up smoking, and stopping being a workaholic, and actually a month later we've lost the plot? Anybody recognize that? Yeah. I mean, we all make this great long list on January the 1st, you know, of all these things that are going to change forever and ever, and by February we've forgotten it. So the point of having a mentor is to actually have your witness, your guide, your support, so that when you hit your resistance, you've actually got somebody there to help you really look at what's got to change and actually support you right through that change until you get to a new level of sustainable health. And boy, is that rewarding. It's rewarding for the mentor and it's rewarding for the client. So the mentors do many things. They help people understand their picture of health. They help them work out where the important things are to work on. And they most of all help people work out how to be true to themselves. But I want to zoom forward and actually get you looking at 3 examples of a picture of health, and then you're going to do your own. So when you start to read a picture of health, basically each one of these dots is a yes or a no. Now somebody's already said, oh, but life isn't like that. It's not black and white, yes or no. Well, just answer whichever's truest for you today, okay, with a yes or a no. Don't take it too seriously, guys. And all your yes answers you score outwards from 0 in the middle. So this person got 1, 2, 3, 4 yeses for food, 2 or 3 for exercise, 3 or 4 for toxicity. And then when you've done it, you plot your yes scores, and then you join up the dots, and then you colour in the middle. And then the blue area in the middle is everything you've said yes to, where you're looking after yourself well, and the empty area around the outside is where there's maybe some work to do. So when you start to read it, you can look at it, first of all, to see where are the big dips, and also which are the quadrants which are quite empty. So this person has not got a very strong relationship with the body, not too bad in the mind, very fulfilled, energy low, spiritual connection a bit low, relationship with nature a bit low. So tell me who you think this person might be. Any guesses? Pardon? Well, it's almost all of us. It's almost all of us in the Western world, isn't it? Because almost all of us have a diet that's too rich and too, not you guys accepted, of course, right? But most of us in the Western world are eating too heavy a diet. We're not exercising, and toxicity, we're a bit toxic. And so these 3 examples I'm going to show you are people that came to me because they were tired all the time, right? So this person was tired all the time because they were out of relationship with their body. They were ignoring the needs of their body for nutrition, oxygen, exercise. So let's look at the next one. So, detectives, what can you see here? Can you shout out? Massive stress. Massive stress. So, relationship not good. Somebody said keeping themselves to themselves. Well, they're doing a lot of exercise, so clearly a bit of a body beautiful. No time at all in nature or the community. Not very happy in the personal environment. Very low energy. Any guesses, man or woman? Man. Man. And what kind of guy do you reckon this is? Businessman. Absolutely. Yeah, goes down the gym. So he thinks he's taking major care of himself. But what do you reckon this guy is at risk of? Heart attack, yeah. Because he's eating a very heavy diet. He's hugely stressed, massively ambitious. He actually probably thinks he's doing quite well, but he's very, very stressed, and he's very isolated. So he's not getting the love and intimacy. He's not getting the connection with nature or his community. He's very isolated. So a lot of leaders get into this kind of situation. Now I'm going to show you a very different picture. So what about this person? A giver? That's interesting. Somebody said a giver. Why did you say that? Okay, because they're not being true to themselves. So very pleasing others, well spotted. Because this person is a pillar of society, doing loads for the environment, very plugged into the community, fantastic home, really conscientious with food and physical exercises, not too toxic, just the odd 7 glasses of Chardonnay when she gets home. Oops. I was going to say, is this a man or a woman? She. It's a woman, yeah. So she's quite stressed, and she's quite isolated, and she's quite toxic emotionally. What kind of stress does this person have, do you think? Well, family, husband and children. So what's she busily stressing herself? More than that. Everything's got to be perfect, hasn't it? So everything's got to be just so. She's got to look perfect. The kids have got to be perfect. They've got to go to violin and hockey and piano, and they've got to have the right house. The house has got to look right. So she's quite a self-stressor. What kind of emotion? She's clearly lonely and isolated. What kind of emotion do you think she's feeling? Resentment. Did I hear resentment? Yeah. She's furious, isn't she? Have you guessed who she is yet? She's the wife of the last guy. And she never sees him because he's on an aeroplane and he's always out the country, and she's at home making everything beautiful and making it all gorgeous, and he's never bloody well there, is he? So, but what's going on with this lady with being true to herself? She just isn't, is she? So everything she's doing is about her husband and her community and her kids, which is great, but she doesn't have her own inner life. She doesn't have a sense of being true to herself. Does anybody recognize this syndrome at all? A few nods out here. So can you see how useful this tool is if you're working in a holistic way? Because you get, for every single one of you in here today, there'll be a bit different picture and a different story. So what I'm going to suggest, all you need is a pen or a pencil, and that what you've got in your pack is you've got a thing that looks like this. And on page 2, you've got 10 questions for each principle, which you're going to whiz through. This is not a really deep exercise, guys. Certainly not today. Whiz through and do yes, no, yes, no, yes, no, yes, no. And at the bottom of each principle, write down your number of yes answers. When you have got to the end of principle 12, there's a little box where you can write down how many yeses you got for each one. And then here, on the back page is a picture of health, and you can plot it from 0 in the center, and then you join up your dots and you color in the middle. Now Moretta and I are going to float around, so if anybody needs help, you just stick up your hand if you get stuck. And then when you've done that, we're going to pair you up so that you start talking to your partner about what this is showing you, and we'll give you about 5-10 minutes in each direction so that you can work out for yourself what you think it's showing you, and maybe go away with one health creation goal for today, one choice as a result of seeing how this comes out. Okay, is that nice and clear? Yep, okay, so off you go. So I would just urge you when you get home to capitalize on doing this exercise, because you've just put a lot of time and effort into that. So to get the most out of it, just have a little tune in, look at those no answers and think to yourself, okay, which are the things I would really like to change, and just work through that back page. And so that you know you'll achieve it, we're looking for, what information do I need? What help do I need? What am I going to commit to by when? Do I need to tell somebody else so that they'll support me? And particularly so they won't sabotage me, okay? And then if you were being mentored, then each month you repeat this whole process and you check in with your mentor by phone, by Skype, or in person. And the process deepens and deepens and deepens as you get to the core of the issue. All right, so I just wanted to, first of all, before I go charging on, are there any questions arising? I believe there's a roving mic somewhere. Yes, the lady's asking, how did I arrive at it? Yes, it's entirely out of my head, but based on the kinds of things we worked as a therapy team at the Bristol Cancer Help Centre, so knowing what mattered to the counsellors, the healers, the energy body workers, the nutritionists, so it's a kind of picture of all of that. Mara.
Right, I was just talking to another lady here about relationships, and I live on my own, and I'm 2 years down the line after a cancer diagnosis. And having finished a relationship, a romantic, emotional relationship, I'm very much on my own. Now, it's actually very difficult if one is going through, you know, taking the food, one's diet very seriously, taking one's detox very seriously. You know, you can't go out with new people and they say, oh, let's have a spaghetti bolognese. Can't eat it. Let's have a glass of wine. Can't drink it. Let's go out and have fun. I shouldn't really be out later than blah, blah. I mean, I often am. That's half my problem. But although, you know, and one doesn't want to meet new friends and say, oh, I've got cancer. And they'll, you know, because that's the last thing you want to, well, I certainly want to say to anybody. I want to try and be as normal as possible. But actually, it's really very difficult.
And I think that this is goes for every aspect of being on a growth path. You are changing, you are evolving, and you are going to become part of a new community of people who are on that path. So you will find, whether it's through yoga classes or through doing healthy cookery classes or coming to France with us or whatever it might be, coming today, you know, talking to your neighbours, people who are on that pathway. And it is particularly relevant actually when you're in a relationship, because if you start going like a greyhound and changing rapidly and your partner doesn't change and gets left behind, that can be tricky. So we also mentor carers. We have a carers program and we try to bring people along together. But I would really just say, you know, there are many places, even if you don't have a primary partner, where you can find a lot of love and attention, whether it's support groups, classes such as the ones you run, but also things like Tantra. There's a fantastic Tantra movement in Great Britain, which is not full-blown yoga Tantra, but about healing relationships, about love and intimacy, about getting support and touch in very honouring, very nurturing ways. Locally here in Frome, we have a lady called Jules Wingfield who's teaching something called Living Love. And absolutely fantastic. And it doesn't have to be about full-blown sexual tantra or relationships, but it's about healing relationship, learning how to receive, learning how to even receive a compliment. So, you know, I think actually we are very fortunate because we live in a time where there are lots of opportunities to find other kinds of relationship. Don't know if that helps at all. Any more questions? Bubbling. I expect there are a million questions.
When I was diagnosed, I was telling Mara it's been 12 years and it was all about going within and finding me again and loving oneself.
But I couldn't agree more that the primary journey is to heal our relationship to ourselves, to learn to be with ourselves and to be true to ourselves. But we can still get lonely, we can still feel isolated, we can still feel very odd if we're somewhere where, you know, there isn't food for us to eat and we're out on our own. And I would just say connect, connect, connect to other people, support groups. We've got the Gerson support group people here. They're part of a big network. Joanna, wherever she is. Where's Joanna? Yeah, Joanna Hill and colleagues. They've got a fantastic network of people. There are many, many networks, you know, to be part of. Okay, so we've got, oh, here we are, another one.
Just a really quick question. You mentioned that you go into schools. Is that true with the Health Creation Programme? I just think it's fantastic. I just really believe that real change
yes,
will
great
come
question.
from, you know, reaching the children.
What we did after, so the evolution was first to write the Cancer Lifeline Kit. That has got within it the blue Cancer Lifeline Programme for the time of diagnosis, the orange Health Creation Programme that doesn't even have the word cancer in it, which is relevant to everybody, and there's a carer's guide for carers. Now, very fortunately, when writing it, it was actually Brandon Bays who said to me, I had a meeting with her, a random meeting, and writing all this kit, and she said, "Rosie, what is your core process?" And I thought, oh shit, I don't know if I've got a core process, actually, Brandon. And she said, well, if you haven't got one, get one. Because people like programs and steps and processes. So that was me in my place. So fortunately, I put everything to do with cancer down one end of the table, everything to do with caring down the other end, and in the middle was everything to do with health and wellness. And very fortunately, this program got born, which has within it the 12 principles. There are 7 steps. Okay, and so there's a journey to wholeness, and people can take this whether they are ill, whether they are carers, whether they're coming through life crisis, or whether they just want to be super well, peak performance, or leaders. So we've now applied this with chief executives of HSBC Bank right through to people who are really, really poorly. In the school sector, one of my clients became a mentor, and then he went on. We've lifted this up into a level called Health Creation at Work, where we take it into companies, schools, organizations, and the questions on the picture of health, instead of being, how are you looking after your health, your well-being, your this, it's how is your organization resourcing you, making you aware, supporting you, training you, you know. And so now the organizational version of this is delivered by our consultants, and this darling man, Mac Jeffrey, who lived for 11 years with melanoma, 7 of which it was in his liver, he pioneered health creation at school, and he managed to get us into 21 Bristol schools. And then the team that he's developed have gone on taking it further. Just to conclude, in terms of next steps for any of you, if any of you today think, I would really like to work with a mentor, you can do that. If newly diagnosed, what you do is you work through the Blue Cancer Lifeline Programme. If you're past the illness bit and the treatment bit and you're into health creation, you work through the Orange Health Creation Programme. If you're a carer, you work through the Carer's Guide. So at the back is my husband, Mike Toos, who has been my absolute support through the whole of this health creation journey. Mike is here to help anybody who wants to engage a mentor or work through a programme. If you think, actually, I would like to be, oh, this is me, if you'd like to have a session with me, I work in Bath in person, or I work over telephone or Skype. So if anybody wants to engage with me, that's possible too. So thank you all very, very, very much for your attention. May I just wish you all healing, all blessings in your healing journey. This has happened to you for a reason, and I'm sure that there is a butterfly coming out of every chrysalis in this room. So bye-bye. Thank you.